one of the more exciting things for me to watch was how medical students have gone out and actually really developed relationships with their patients. The best example is a student who had followed a gentleman while he was in the hospital who was diagnosed with terminal cancer and then went to the hospice house. And this student, on a day off, when he didn't have to be there clinically, went to the hospice house and sat with this patient and his wife while he took his last breath.
The student really gets in there and does a really, really lengthy story of their life. And, you know, patients like to tell their story and then what's wrong with them and have another kind of bright mind look at their problems. I precepted several students where the patients actually were asking for the students to come in to work with them. So they've really found it to be an amazing experience, I think.
The students do see the medical records, and so there are a lot of people worry about that sort of legally, medical legally, but also personally. But that's something that the students have to learn how to deal with, because that's going to be an issue the rest of their lives, of course.
People in the hospital getting accustomed to the students being there, patients, staff, and then the students themselves becoming more accustomed with their role, so that the interactions are just becoming a little more, a little easier, a little more routine. But people are just getting used to the idea that students are here.
Students are very tentative at first when they go to interview patients, and they get exposed to a lot of clinical skill teaching in the first and second years, even before they go out into the hospitals and on the wards. What third year is about is becoming more familiar and more comfortable just talking to patients.
If I had a patient that was in the hospital and it was after a long day, you know, even before I went home, sometimes I would go just see them and see how they were doing the rest of the day. I think they were thankful for that and just kind of liked that somebody was really looking out for them and following them, and it just makes them feel appreciated. So I think that actually did help open up a few relationships of patients that I've had in the past. So.